Hi, Dr. Cline here. This video is intended to go over some discharge instructions for your dog or cat's neuter procedure that they had done in hospital today. When you pick up your pet, if you have a dog, you will notice that they have a shave spot for an IV catheter. That is where IV fluids and IV anesthesia is administered for them during the procedure today. For cats, cat neuters, they do not have an IV catheter shaved spot, and so their anesthesia is a little bit different, and we use intramuscular injection for these guys. So for dogs, you will notice a small pre-scrotal incision. It is very normal to have a little bit of redness around that incision, but I want you to watch really closely at home for any significant swelling, significant bruising, especially around that incision and around the scrotum. If you have an older dog that was neutered or a bigger dog, these guys are a little bit more at risk for developing what's called a scrotal hematoma. And so if you do notice any significant swelling or bruising, especially around the scrotum, please reach out and let us know. You shouldn't be seeing any kind of discharge or bleeding or anything from that incision site. All of the stitches are on the inside, and so those will dissolve on their own. Your pet doesn't have to come back to have anything removed. That incision takes about 10 to 14 days to heal, and so during that time, it's really critical for you to keep them rested, which I know can be hard for a lot of animals post-operatively, and so we may or may not prescribe sedatives kind of after speaking with you about their lifestyle and what you think that they may need at home. We'll go over those with you at the time of discharge when you pick up your pets. We'll also send home pain medication that may include a non-steroidal anti-inflammatory and potentially another medicine, and that will be on a kind of specific case-by-case basis as well. Your pet will also go home with an e-collar or a cone, and it is really critical that they keep that on at all times while that incision is healing for the next 10 to 14 days. We find that the donut collars don't tend to work as well because animals are usually able to kind of get around that and start licking at their incisions, and it can be a matter of minutes before we are causing secondary infection or even opening up that incision, and then we run the risk of potentially having to go in and do another second sedated procedure to repair that. And so keeping the cone on at all times is really critical. For dogs, leash walk only to go outside and use the bathroom, and then just back inside resting. If they are crate trained, I think that is perfect. Or if you can confine them to a smaller area just so that they can't get up and kind of have the zoomies or run up and down the stairs. We want to try and keep that more controlled on leash so that they're not too active. No running, jumping, or playing with other pets during this post-op period. For cat neuters, they're a little bit different than dogs. And so for cats, the incision is actually on the scrotum itself. And so cats are a little bit more sensitive to suture. And so those are a much smaller incisions for cats, and we actually leave those open and don't suture. So we allow those to heal on their own by what's called second intention. You may notice with cats a little bit of blood tinged kind of red discharge from those incisions for the next 12 to 24 hours. That is to be expected, but there shouldn't be any active bleeding. So I usually tell people if you want to confine them to a smaller area or a bathroom, it is to be expected that there might be a little bit of kind of blood tinge from their incision this evening would be normal. Also important for them to try and keep their e-collar on as well, so that they don't lick at their incisions, and try and keep their activity as low as possible. I know that can be harder in cats, but I think confining them to a smaller room, avoiding any interaction with other pets in the home. Don't want them playing with other cats or dogs while they're in this post-op recovery period. And then truly, if they need sedatives as well, we certainly can talk about options for cats. You can offer your pet some food this evening. They may or may not want to eat. Every animal is a little bit different after anesthesia. And so if they are not super interested in eating tonight, that's totally fine. I would expect their appetite and attitude to be pretty much back to normal by tomorrow morning, maybe tomorrow afternoon. But if you have any concerns about that at all, just reach out and let us know. For dogs, please wait a full 2 weeks before you give them a bath or let them go swimming. We don't want to have any any incision being submerged in water until it's fully healed. And so if you have any concerns about the healing process or making sure that everything's healed up well and that they can return back to normal activity, you can always send us a photo or have them come by for a quick recheck, and we could just make sure that they're all cleared to go back to normal. But if you have any questions at all, please feel free to reach out to us and let us know.